Some eye-opening information tonight about why it takes so long to not only get tested for COVID-19, but also to get results. The Canadian Society for Medical Laboratory Science says there aren't enough lab techs or equipment across Ontario to meet the growing demand.
During a time like this, you realize that we weren't ready for this surge.
A shortage of medical lab technologists is making it difficult to keep up with the surge of COVID-19 tests in Canada. It takes 4 hours to test just 96 specimens, and there are only about 20,000 techs across the country.
The one thing we ask people to be right now is patient. You know, if you've been told it's going to be 48 hours and it's taking 3 days, 4 days, 5 days, follow the instructions you were given from your physician, which means that you should be in quarantine right now.
It has, of course, been a challenge for people with symptoms whose lives have been turned upside down as they wait for results. We spoke with one woman who has been waiting more than a week. She was tested last Wednesday after she was exposed at a conference in Toronto where someone else tested positive.
There is no answers. No one even knows anything about you. And now, of course, it's more frustrating because I can't even get hold of anyone who you can even speak to anymore.
And another woman who was denied testing entirely. She has the symptoms and has a young child at home.
I think it's inappropriate that they're having us use these tools and telling us to take this precaution and go and get tested, and we build up the confidence to go there and then get turned away.
On Friday, the province directed hospitals to test only those with severe symptoms, prioritizing symptomatic contacts of confirmed cases and healthcare workers, among others.
I've heard comments that every Canadian should be tested. Well, there's no way we could do 36 million tests of anything. Medical lab professionals have to work in a manner that makes sure that we know when we release data, it is accurate and precise.
The plan is to triage those most likely to have it will be tested first, but eventually interim measures to get more equipment and test kits will mean that the province can ramp up testing.
The need for these test kits is growing. While we ramp up, we're making sure Canada is ready to keep up.
The plan is to purchase additional lab equipment to analyze tests, which costs $10,000 to $20,000 apiece. And on top of COVID-19 testing, these medical lab professionals conduct up to 440 million other tests a year.